Foundation and Community Education Services, I would like to welcome you to our virtual workshop on this very lovely evening, Acceptance and Commitment Therapy for Caregivers, What's It All About? And this is being presented by our very own CNEV staff, Tanisha Gruber. My name is Kate Bergoli, and I have the privilege of working in the CNEV Family Foundation Resource Center, providing information, navigation, and supports to all individuals, families, and professionals impacted by autism. We try to connect people with appropriate supports, either in the community or, of course, our own programs, which include Employment Works, a program helping individuals who are seeking support to find and keep a job, and our Launch Plus Skills, offering individualized transition planning plus skill development for autistic and neurodiverse individuals interested in continuing their education, getting a job, or building their independent living skills. Laura of Community Education Services will be our host for the evening. We have been partnering with CES for a number of years, and they have always provided our events with the online platform and support. I am very thankful for this these days, as that is not my strong suit. I just want to go over a few housekeeping requests to make sure that this presentation goes smoothly. If you could please use the chat option located on the right-hand side of your screen, not the Q&A, for any questions you have during the presentation. Please choose the option host and panelists so that both our presenter and our host, Laura from CES, can have access to your questions, as we don't want to miss anything. Just to let you know, we will address all questions at the end of the presentation, and this is just to keep the flow, as we are recording this to be able to see it at a future date or listen to it. If you do have any technical issues, you can direct your questions to host Laura, and she will help you out. Before beginning our presentation, I would like to take this opportunity to acknowledge the traditional territories of people of the Treaty 7 region of Southern Alberta. This includes the Blackfoot Confederacy, comprising of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. It is now great pleasure that I introduce our presenter, Tanisha Gruber. Tanisha is a registered occupational therapist and a Canadian certified counselor. She has over 20 years of experience working with individuals on the autism spectrum and their families. When meeting with clients, she utilizes a strength-based approach to help them create realistic goals and action plans towards better functioning in their daily lives. Tanisha also has training and experience with developmental and sensory processing differences, mindfulness, mental health, and motor, cognitive, and visual perceptual skills. She works with her clients to improve their ability to face their challenges. And I must say, on a personal note, she has always been such a supportive colleague and a wealth of knowledge and expertise, which she is always happy to share with all of us. So welcome, Tanisha, and thank you so much for presenting for us today.
Well, thank you, Kate, for the lovely introduction, and thank you, Laura and Shane, for helping me. So welcome, everybody, to my presentation tonight, Acceptance and Commitment Training for Caregivers. What's it all about? I really appreciate you all being here. It is a lovely evening, at least it was when I drove here. So hopefully I won't take up too much of your time. Okay, just a sec here. Okay, the objectives tonight are to learn about ACT and how it can help improve coping skills and well-being, to experience present moment awareness, to experience a mindful daily activity, and hopefully you'll leave the workshop with at least 4 strategies from the ACT core processes. So ACT for caregivers, what exactly is that? So we acknowledge that being a parent of a special needs child is very stressful. In fact, it puts us at a higher risk for mental and physical health problems. And what this picture is depicting is the instructions we get when we're on an airplane from the flight attendant is always to, in the case of an emergency, when the oxygen mask drops down, to put it on yourself first before you provide assistance to another person. And that can become a metaphor for the ACT workshops, is that we recognize that we have to help ourselves before we can help our children. And so I'll just caution you right now, this workshop is not about strategies to help your child who has autism or other developmental disabilities. It is a workshop. There are other workshops for that. This workshop is about your own self-care, about helping you cope with the stress. Okay, so what is ACT? Well, ACT is an acronym for Acceptance and Commitment Therapy, or the T can also be training. ACT is a process that seeks to help individuals to struggle less with difficult things in their lives and mindfully connect with things that are most important in a way that is loving and respectful. And this is a quote from Lee Steele. She is a parent of a young adult with autism, and she's also one of the ACT co-facilitators. So the acronym can also be broken down this way. A can be for accept our thoughts and feelings. The paradox is that our psychological problems worsen sometimes if we try to get rid of them. ACT looks at mental health in a non-pathological way. Western medicine tends to look at health as the absence of disease to treat illness, and they try to find out what's wrong, break things down into little parts, and fix what's broken. And sometimes this approach is used also to extend to our problems and suffering. So we look at our problems and we try to find reasons, and we ask, why do we suffer? There must be something wrong with me. There must be something wrong with the way I'm thinking and feeling. Life shouldn't be like this. Maybe I need to correct my thoughts and have positive feelings. But in ACT, they look at it differently. They look at it in a way that the human mind is it's normal for the human mind to anticipate danger, and that's why we as a human species have survived. That's why we are able to do so many things and be so successful. But the human mind can also trip us up because we anticipate future danger, we get into our worry thoughts, we have memories, we can remember the past, we regret our past mistakes. So for this reason, ACT looks at pain as just part of life, and the human mind can set us up for suffering if we don't recognize what is happening and learn to accept our thoughts and feelings. So accepting pain is part of life, and trying to avoid it leads to suffering. The C can stand for choose. Choose our direction in life by identifying, focusing on what really matters. So in ACT, we really examine what are our values, what is really important, what matters to us. And the T can stand for take committed action. And so once we've established what our values and what's important to us, then we really try to take committed action to live our life in the direction of those values. So ACT promotes well-being in populations that experience distress. And just a little bit of history. It was developed in the late 80s by Stephen Hayes, Kelly Wilson, and Kirk Strassel. It is evidence-based practice, and there have been many studies since then that prove its effectiveness in a wide variety of different populations. There was a meta-analysis done in 2015 by HAC and colleagues, and the conclusions were that ACT is effective in treating anxiety disorders, depression, addiction, somatic health problems, and it is an established psychological intervention. And then in 2006, Blackledge and Hayes did a study where with parents of children with autism, and they discovered that these parents experienced decreased depressive symptoms. So based on this study, Yona Lunsky, a researcher in Toronto, and her colleague Kenneth Fung, a psychiatrist, decided to start facilitating ACT workshops for parents of children with autism and developmental disabilities. And what they discovered during this process was that Kenneth Fung is not only a psychiatrist, but he's a parent of a son with autism. And they found that his presence just added authenticity and credibility to the group, and the parents were really drawn to what he had to say. And, you know, if that could help him in his life, then maybe it could help me. So after that experience, they started as routine training parents as co-facilitators. And now these workshops are always run with a professional or a clinician and a parent that's been trained to be a co-facilitator. And so that is what we do here at the Cine Family Foundation. In 2019, my colleague Judy Glass, who works with Kate in the Resource Center, her and I went to Toronto and we trained to deliver these ACT workshops for caregivers. They are 5-session workshops. We are in, and then of course COVID hit, so we had to go back to the drawing board and we learned how to deliver them virtually. So we're now delivering our second workshop virtually, and we will be offering another one in the fall. So hopefully tonight, you'll sort of learn something about what ACT is about, and if it's something that you think could help you, then we welcome you to sign up for our workshop in the fall. Okay, so I'd just like to take a minute, and ACT is really what we call an experiential therapy or training. In other words, I can't just sit here and talk to you about it. You really have to experience it to know the power of it. So we're just going to take a minute and do one of the ACT exercises, which is called a 3-minute breathing space. So in any moment, we can find grounding in the breath. So I'll just ask you to find a comfortable seat, put your feet flat on the floor, sit upright with your back against the chair, or upright, leaning forward with your back not against the chair. So in our reality as parents, sometimes a long sitting meditation or a lengthy self-care, doing something lengthy for self-care just seems out of the reach. So one of the advantages of this exercise is it only takes 3 minutes. And while you're doing this exercise, it's helpful to imagine an hourglass. So if you go away tonight, this might help you remember how to do it. So you're going to start with just trying to get in the here and now, noticing what's happening in the room, noticing what's happening in your body. And then we're going to narrow our focus. So you're going to really zero in and focus in on the breath, just the simple sensations of breathing. And then we're going to bring our focus back out to whole body awareness and back into the room. So the whole exercise is 3 minutes, 1 minute, 1 minute, and 1 minute. Okay, and at the sound of the bell, I will begin. Allow your eyes to close, or if you prefer, allow your gaze to become unfocused and gently just look in front of you. To begin, I would like to invite you to become aware of your experience in the here and now. Just maybe focus in on the sounds in the room. Just focus in on being present in this meeting. If you notice thoughts are coming into your head, just notice what they are and gently come back into the present moment experience of being in the room. Now just notice your body, notice any feelings that are arising, any anxiety, any other kinds of feelings. And notice any bodily sensations. And as they show up, try to just observe them, notice them, without getting lost in them or judging them. Now gently gather your awareness, sharpen your focus, and bring your fullest attention to your breath. See if you can trace the rise and fall of your breath. Breathing in and breathing out. Noticing it coming in through your nose and going out through your nose. Allow the breath to become the center and anchor of your calm awareness. If thoughts or other distractions come into your awareness, just gently notice them and go back to the breath. Now we'll broaden our attention once again, beginning from the tip of your nose. Gradually widen your attention to become aware of your entire body. It is as if your entire body is breathing. Connect to the sensation of your body against the chair. Ground yourself with the sensation of the floor beneath your feet. Really feel that sense of security and groundedness. Become aware of your entire being, your presence in this space, your presence in this meeting. And after the sound of the bell, whenever you're ready, open your eyes with renewed awareness and attention. So now I'll just invite you to write in the chat maybe one word or a short phrase about how that 3-minute breathing exercise was for you. If you found it calming or how that was. Now I can't see the chat, so maybe afterwards we can see. Okay, so in ACT, we teach 6 core processes. So in the 5-session workshop, we actually do 1 process each night. For 2 of them, we do 2 in 1 night. So this is a shape of a hexaflex, meaning 6 sides. And so the 6 core processes of ACT, starting in the bottom left, are watch your thinking, open up, be here now, changing sense of self, down at the bottom, know what matters, and do what it takes. And if you're successful in all these things, or if you are starting to do some of these things, then this will result in more flexibility, being able to be more present, to be more open, and to do what matters in your life. And if you'll notice, each of these core processes are interconnected. They're connected to each other, and they all intersect in the middle. And the reason for that is they're not really strict, isolated processes, but they do all interconnect, and there's a lot of overlap. So what's the opposite? And this is what we call the hexaflex of psychological flexibility. That seems like a fancy word, but the opposite of that is the inhexaflex. And so we can start over-identifying or believing our thoughts. We treat our thoughts as reality, as if our thoughts and reality are fused into one, and this can add suffering to an already challenging situation. So, for example, a caregiver might think, oh, I was really impatient with my child, I yelled at my child, I'm a terrible mother. And if she believes that thought, then that's going to add suffering to her pain. But if she's able to kind of separate herself from that thought, start to notice her thought, then she realizes that a thought is just a thought, no more and no less. And so then all of a sudden, the thought of being a bad mother will open room to have compassion with herself as a parent, and the thought changes to, I'm only human and I'm doing my best. We all make mistakes. In ACT, we help you to recognize that thoughts are just thoughts. They're not facts. They're just guesses and they can be wrong. And again, our human mind sets us up for this because, you know, a lot of the things in our head are facts, like the sun is round, the sun is hot, the sun goes down at night. We need all these facts to kind of survive in the world. But the problem comes when we start to believe every thought, especially when they're you know, thoughts about worries about the future or regrets about the past or stories we tell about ourselves or other people, when we get into judgment and blame and self-blame, that's when believing our thoughts can trip us up. So many thoughts are not true or helpful. The next area is avoidance. And so we might often attempt to avoid our unwanted thoughts, feelings, bodily sensations, and our memories. And the caregiver example would be, you know, a caregiver might not want to tell her children to clean their rooms because she knows it's going to have a battle. She's going to get impatient, she's going to get frustrated and end up doing it herself. So she avoids asking them to clean their rooms. So in ACT, what we teach is an acceptance of thoughts and feelings, or an opening up. So in the caregiver example, you know, she decided that her value was really to help her children become independent. And so she decided to stick with the original plan, to tell them to clean their rooms, and she didn't do it for them. So ACT teaches us to recognize our difficult feelings and thoughts and to bring an attitude of acceptance to them. In ACT, we do not try to control, suppress, or avoid difficult thoughts and feelings. The next area that can trip us up is future worry, past regret, or living our lives on automatic pilot. So in this area, I'd like you to think of, where does the mind go when it's not engaged in the present moment? We can get stuck in our thoughts about the past or concerns about the future, and we can go through our day on automatic pilot. And that means we just carrying out our routines mechanically while thinking about something else, and we're really not enjoying our life. And the caregiver example was, the mother was really stuck in her guilt about spending so much time with her child with special needs, and not spending as much time with her typically developing child. And the example of automatic pilot is, I remember one day, at one point in my life, I was involved with a lot of caregiving for my mother, and every day I drove to the care facility where she was staying. But one day I had a medical appointment for myself, and it was about 5 minutes before the appointment was supposed to begin. And I looked around me and I realized that I was driving to the care facility and I was actually going the wrong way. And I had to turn the car around and I ended up being late for the appointment. So that's just an example of automatic pilot, when we're doing something out of routine, but we're not really thinking about what we're doing. And so the opposite of that is to try to more often be here now. I don't know if you can see my hands, but rather than going into future worry or past regret, we try to come back to the present moment. So the caregiver example is, she tried to intentionally engage in sensory experiences of her daily life For example, like going for a walk, rather than allowing herself to get caught up in her worries or her problems, she'd really just try to focus on the sensory aspects of the activity. So what are the sights? What are the sounds? What is my body doing? What are the sensations? How am I moving? What things can I feel? What's the temperature of the air? And I invite you, after you leave this workshop, to really go home or I guess you all are home, but to really notice your children in a mindful way, or just try to look at them, look at their beauty, look at how very special they are, just the way they are. Maybe when they're talking, really listening to them. If they're nonverbal, what delightful sounds do they make? And if you notice thoughts, worry thoughts or judgmental thoughts, like why can't they be more like this or more like that, just notice those thoughts, let them go, and come back to just enjoying your beautiful child just the way they are. And another example for me, of course, would be to carefully focus on my driving. So ACT can help you to shift attention to what is happening in the here and now, including thoughts, feelings, body sensations, and external stimuli. And this helps us to respond more effectively to the present situation. And the 3-minute breathing space is an example of that. So the next one is we can get stuck in our roles and our identities. And this is particularly problematic during COVID, when so many people have lost their jobs. They really lose a sense of who they are and their purpose in life. A caregiver example is perhaps a parent gives up their career to stay home with their newly diagnosed child and then suffers a loss of sense of self. So ACT, what we teach is to have a changing sense of self. And the hand gesture is to cup one hand, the fist in the other. And the hand that's cradling the other hand, we start to think of ourselves as the experiencer of our experiences. So this is the experience, and this is these are the experiences. And this can be a difficult concept, but if you just think about a summer memory you had as a child. And now think of a summer memory maybe you had as a teenager. And then think about what you were doing last summer. And you see that you're not the same person that you were when you were a child or a teenager, or that you are now, but rather you are the experiencer of all those experiences. So in the caregiver example, having a new purpose in his role as a parent, he used all his skills to advocate for his child, to set up services, and to start a support group. So ACT teaches you to be the observer of your thoughts, feelings, and experiences. Everything changes all the time, including who you are. You are the experiencer of your experiences and the stages of your life. And as your roles and identities change, you can take the same strengths and character traits into your different experiences, roles, and situations. So the next area, which is particularly problematic sometimes for parents of special needs children, because we devote so much time and energy to our children, we actually lose sight of our own values and what's important to us. And so we get caught up and we're not clear on our own values. And our actions might be governed by unworkable rules, stories, and cultural values. And our actions can also be guided by avoidance strategies. So in ACT, what we do is the caregiver example is one of the mothers really loved art, but she had given up her art to care for her daughter with special needs, and she found herself very depressed because she did not take time to do something that was so important to her. So in ACT, we spend a lot of time really trying to find out what matters to us, what's important to us. And we cherish those values and we hold them in our hands once we really define what they are. The caregiver example is in sorting out her values, the mother realized that self-expression through painting was very important to her, so she made time for it. So ACT helps you to identify those things that are really important to you. The other area we can get caught up in is inaction, impulsivity, and avoidance. And these are patterns of behavior that prevent us from taking action towards a meaningful life. So the caregiver example, the mother who loved her art was far too busy to paint in her studio because she was busy doing everything for her family. Another caregiver stated that when her daughter was in school, she was supposed to do a lot of therapy and homework with her, but this was such a frustrating experience because her daughter had attentional issues and would often engage in off-task behavior. So the mother would she would anticipate it was going to be a frustrating experience and she would avoid it by doing something else. And then she'd get wrapped up in her guilt because, you know, she hadn't done therapy and homework with her daughter. So in ACT, we really focus on doing what it takes, and the hand gesture is grasping both our pinkies like this. So in the caregiver example, the mother identified that, you know what, painting and expressing herself through art was one of her values, and she took committed action by booking the art studio. She delegated child pickups. She prepared dinner the night before, and she said no to extra work. And the other caregiver I talked about that was avoiding working with her daughter, she took committed action and she got help in terms of dealing with her own emotions and finding strategies to help her daughter stay focused and engaged. So ACT really encourages us to do the things that we care about more. And so this changes our overall approach as being an inflexible one to being present, opening up, and doing what matters. So what is mindfulness? Well, mindfulness means paying attention in a particular way on purpose in the present moment and not judgmentally. And John Kabat-Zinn in the 1980s brought mindfulness to North America and started using it to help people with chronic pain. He developed the Mindfulness-Based Stress Reduction Program. And then this program extended to other populations with life issues such as anxiety, depression, chronic stress, and also parents of special needs children. And he's written a couple of books which I'd recommend. One is Full Catastrophe Living. I just love the title. My husband and I, sometimes when we're going through a struggle, we'll just kind of look at each other and go, yeah, it's the full catastrophe. And then he also wrote a book, Wherever You Go, There You Are. So why I'm bringing this up is mindfulness-based approaches have been shown to be effective in improving the mental health of parents of youth and adults with autism and other developmental disabilities. And Yona Lunsky, who I talked about earlier, has done some research on this, and she offers virtual mindfulness classes for parents of autistic teens and adults. And the results of the study were reduced levels of distress, and these were maintained at 3 months follow-up. And also participants reported increased mindfulness, which I'll explain as we go along here, what that term means. And so if you notice on the left-hand side, 4 of these processes are what we call mindfulness-based processes. So watch your thinking, open up, or acceptance, be here now, or present moment awareness, changing sense of self. These are all what we call mindfulness-based processes. So what I wanted to do now is to leave you all with 4 or 5 strategies that you can take after you leave tonight that may help you in your everyday life towards coping with your stress and towards your own self-care. So I just wanted to show you this cute little cartoon video because I think it really helps you to understand what we mean by notice your thoughts. So that's from that's a animation from one of my favorite mindfulness or meditation apps called Headspace, which I'd highly recommend if you're just getting new to mindfulness or meditation. Okay. So here's some other techniques we teach in the ACT for Caregivers workshops. And one of them is thought labeling. So this is an idea if you find out that if you find yourself really getting caught up in your thoughts, especially if they're distressing thoughts, so maybe you're thinking, oh, this situation's impossible, I can't possibly cope with this. If you notice yourself having that thought, just add, I'm having the thought that my situation is impossible. The other idea is once you can start noticing your thoughts, you might start labeling the type of thought you're having. So maybe you're trying to mindfully connect with your child. And then you notice yourself going into, oh, I have to, you know, pick up the groceries. I've got to pick the kids up from school. I've got to cook supper. I've got to clean the house. Then when you notice yourself doing that, and the intention was to mindfully connect with your child, just label the thought, planning, and go back to what the intention was, mindfully connecting with your child. Maybe you're having a judgment about something. Oh, you know, that person is, to blame for all my problems. So just notice yourself having that thought and go, oh, okay, I'm judging. I'm making a judgment. Sometimes you might be making a prediction. So you might be saying, oh, I'm never going to get that job, or this person is not going to be able to help my son or daughter. And just notice that you're having that thought and you go, oh, yeah, I'm trying to predict the future. Some other ideas to start noticing your thoughts are to learn to meditate. And to meditate simply means to focus on one thing. In mindfulness, we tend to focus on the breath, because you always have your breath. You can do that anywhere you go. Some of my favorite apps are Headspace, Calm, and a free app from Anxiety Canada is Mind Shift, and it has a few really simple meditations, such as mindfulness of the breath and body scan, which is where you focus on the different parts of your body sequentially. That's a really good one. A body scan is really good for helping you to fall asleep or to relax. And it also has a lot of other suggestions and activities for helping with anxiety, and that's Mind Shift. Sunni Family Foundation advertises the Center for Addiction and Mental Health virtual mindfulness classes. They run classes for autistic adults, for caregivers and siblings of individuals with autism, and sometimes they'll run groups with caregivers and the autistic adult at the same time. And these groups in the past have been run by Sue Hutton, and she is fantastic. And her website is Sue Hutton Mindfulness, and she has a lot of free meditations on there. And she has a lot of meditations that are specially adapted for people with autism. The next one is accepting our feelings. Well, how do we do that? That's easier said than done. So a simple technique that is easy to remember is the acronym RAIN. And RAIN stands for Recognize, Accept, Investigate, and Nurture. So R, recognize. So just when you notice that you're upset or you're having a difficult feeling, just stop and ask yourself, what am I feeling? And where in my body am I feeling that? And try to really get out of the story that that, or the thought that has created that feeling, and really just try to focus in on the bodily sensation of that feeling. And identify, what is this here? What is it? Fear, sadness, grief, anger, guilt. And then bring an attitude of acceptance to it. So then rather than trying to get rid of it or push it away, just hold the experience with care and compassion for yourself. Investigate, where in my body am I feeling it? And maybe what thought or situation triggered this? Oh yes, I'm having a worry thought about the future, a what if thought, and I'm feeling anxious and I'm feeling it in my chest. And then the N stands for nurture. See the emotion as just an emotion, and notice that emotions come and go. They're just like waves on the ocean, they'll come and go. If you're feeling angry, it doesn't mean you're an angry person. You don't have to identify with that emotion. Just notice it for what it is, something that will come, something that will go. And let go of any tendency to identify it with it. And bring an attitude of self-compassion. And what I mean by that is you can do something called a self-compassion break, or do something to nurture yourself. Another website I recommend is by Kristen Neff. She's a psychologist and a researcher, and her website is selfcompassion.org. So for an example, what a self-compassion break would be is to find a soothing gesture. I like hand over the heart. Some people might want to just clasp their hands. You might want to give yourself a hug. And just say to yourself, this is painful. This hurts. Ouch. And then the second step is to recognize that this is a human condition and you're not alone in this, and just to normalize it. I'm not alone in this, other people feel this way. And then the third step is to just ask yourself, what do I need to hear right now? So it might be something like, this too will pass, or the example I gave of the caregiver, she would say to herself when she was feeling, when she was calling herself a bad mother, she said, I'm human and I'm just doing the best I can. Whatever words of reassurance or compassion you need to hear, just tell yourself, as if you were being a mother or a father, or a safe person to yourself. And so what do you care about? So I just invite you to start thinking about, what are the things that are really important to you in your life? And some of the questions you can ask are, what is most important to me in my life? What am I passionate about? And what brings tears of inspiration to my eyes? I know when I was doing this exercise, I just started noticing what things just brought tears of inspiration to my eyes. And it might have been like a YouTube I'd watch where an autistic child would get up on stage, and even though he was blind and had, obvious challenges, he sang beautifully like an angel, and I just found myself crying. And that kind of told me that maybe, working with special needs children was something that I really wanted to do, something I was passionate about, and families with special needs. Just think about, how do I want to spend my time? What do I think about? What do I talk about? What do I fill my space with? I find it very interesting now that we're all on Zoom meetings, and we get to have a little, we get to look into people's homes a little bit, and some people in the background just see lots of exercise equipment, and that'll tell you that, they value, their physical health. Other people you'll see, if I was at home, I would, you'd see a bookshelf behind me. And, so that would tell you that I really value mental stimulation. I value my career. A lot of them are books about my job as an occupational therapist and a counselor. Other people have pictures of their family. So just really start to look around your house, and what do you fill your space with? And then what are you most motivated to do? So these are the things that you don't have to, these are the things you don't procrastinate about. These are the things you don't have to force yourself to do. These are the things that you just get up in the morning and you're just gung-ho to do them. These will give you clues as to what your values are. You can also think about your values in terms of the different life domains. So family, parenting, life partners, your relationship with your life partner, self-care. Do you have values in the areas of health, well-being, physical health, and mental health? Leisure, recreation. Some people work to live. Some people work to do, their to go rock climbing and mountain climbing and do their outdoor sports, or to play board games. Financial. Some people are one of their highest values is their financial goals, into earning and saving a lot of money and having material things. Some people have a high value of productive activity or their vocation. Lifelong learning, mental stimulation can be a value. Other people highly value friends, social life, community, and other people highly value their religion or their spirituality, whatever that means to you. It's also helpful if you want to maybe put them, like, which ones are most important. So put them in order of importance if you can. Another way to think of it is to imagine that they're throwing a 100th birthday party for you. So you've lived a good life and you've had the type of life that you would have wanted to live. And your family, friends, and coworkers have organized this party for you. And they prepared a speech. What would you like them to say about your values, about what you cared about, and about what you did in the service of who and what you cared about? Really start to think about those things and write them down, and that'll let you know what's important to you in your life. So here's a simple exercise you might want to do, is to think about a life area right now that you'd like to work on. And hopefully after this workshop, I've encouraged you to work on self-care, but it can be any value. Some people really want to work on something involved with their family or another value. So remember, a value is a chosen life direction. It's not something that you can attain. For example, being a good parent is something you never actually attain because you'll always be the mother, father, or parent to your child as long as you live. But you can set a goal in that area, and goals are achievable and they help us to live our values, and you can plan simple action steps to move towards those goals. So here's my example. This is Judy. She's married. She's a mother of 2 young adults. One has autism and she works part-time. And the life area she chose was self-care. And her value was artistic expression. I've talked about her earlier. So her goal for over the next month is to complete a painting by June 2021. And so her action step for the next week is to look through photographs of flowers and choose one to paint. And so choose something simple, something achievable, something doable. So hopefully this hasn't sounded too complex, because actually ACT can be boiled down into one simple sentence. And here's something I'll say to myself if I find myself getting distracted by worry thoughts or forgetting my focus or getting sidetracked. I'll just remind myself that I am here now, accepting the way I feel and noticing my thoughts while doing what I care about. So the last takeaway I'll leave you with today is a simple exercise we can practice here, and then you can practice it at home. And this is mindfulness of an object. So I just invite you to find something that's maybe on the desk in front of you or in the room. It can be anything. I'm going to choose this hand sanitizer here. And I just invite you to pick it up. So I just want you to really, what we're going to do is really just focus on the sensory aspect of this object. So I want you just to really look at it. Just notice how the light reflects off it. Notice the shape, whatever object you have. You might have a pen, you might have a piece of paper, whatever it is. Just really notice how it looks, what colors it has. You can turn it around. Notice if it makes a sound. Just close your eyes and really notice how it feels. Just really notice any textures, or is it a hard surface or a soft surface? Maybe notice the sounds as you move it around in your hands. Really notice your body movements as you manipulate it. How is your hand grasping it? How is your arm moving it? Notice if it has a smell. And if you have an object that's food, you can taste it or imagine what it would taste like. So that's just a simple activity called mindfulness of an object. And what I invite you to do is, after you leave this workshop, is just think about one activity you do every day. And I just invite you to do it mindfully. And what I mean by that is to try to get out of your mind and just really get into the sensory experience. When I first started doing this, the first activity I chose was washing the dishes. So, you know, those dishes that don't go in the dishwasher. So I found myself, whenever I was washing dishes, I'd start ruminating about these unsolvable problems. And I just found it became a miserable activity for me. So I decided to just mindfully do it. And so what that would mean is I would really get into the sensory aspect of it. So maybe how does the water feel when I put my hands in the water? What's the temperature of the water? What does it look like? Like what do the bubbles look like? How is the light reflecting off the bubbles? What do the plates look like? What shape are the plates? What color are the plates? And as I wash the dishes, I'd start to notice, you know, oh, look at how my hands just know how to manipulate the plates and turn them and wash them. What's my body posture like as I stand at the sink? And what sounds can I hear as I do this activity? So the idea is really just to get out of your thoughts and into your mind. I mean, out of your thoughts and into your senses, the senses of the activity. And you can choose different activities. It might be eating. Eating's a great one. We often just eat food without even really thinking about it. It can be brushing the teeth, washing your face, showering, or like I mentioned earlier, I invite you to really interact with your loved one in a mindful way. So once again, we offer Caring for the Caregiver, Acceptance and Commitment Therapy. It is a 5 to 6 session workshop hosted by Sini Family Foundation. The next session we're offering is in the fall. There are 2 facilitators, myself. I'm a parent and a clinician of an autistic adult, and the other facilitator is a parent, and she also works here at Sini. And if you'd like further information, or if you have any questions that I'm not able to answer tonight, you can contact me at this email address. And if you spell my name wrong and don't get through, then just go info@sinifoundation.org. So in closing, my suggestion is do something mindfully after today's session. Maybe go outside if the weather's still nice, and mindfully go for a walk. And I invite you if you have any questions.
Thank you very much, Tanisha. Hello, everyone. My name is Shane Lynch. I work with Kate and Tanisha at the Sneed Family Foundation. Thanks, Tanisha, for all of this great information. You shared some really great strategies, some things that are very, very practical for folks. I know there's lots of takeaways that people can walk away with. For those in attendance tonight, if you do have any questions or reflections that you want to offer, please post them in the chat. That's where we will look for your questions and try to answer them as they come up. I want to share with the group or want to share with everyone that at Sneed we have introduced ACT training for our professional practice team just over a year ago. It was actually just a little bit before we went into the first COVID wave, the first lockdown. And Tanisha's been able to provide leadership to our staff with our training in ACT, which has been wonderful. Since then, we really have incorporated ACT strategies into the programs that we provide to the community, which, really although we haven't taken, any tangible data on our application of ACT, what we're really seeing anecdotally from our participants is, more, I think a clear vision or a clear set of values for what it is that they want to achieve. And I think it makes us better at helping them achieve their goals. So it's been a fantastic addition to our practice. Personally, I want to comment that the ACT framework and strategies have really been a game changer for me individually, as personally and professionally. What stands out in particular, the notion that Tanisha talked about tonight of our thoughts being just thoughts, not facts. For myself, when I think about self-doubt, anxiety, all of the things that we all struggle with, part of the human condition, that notion that thoughts are just our thoughts and they're not facts has really helped me to understand that I'm simply thinking a thought. It's not a fact. It allows me to see things more objectively. It helps me problem solve more effectively, and it also helps me to cut myself some slack, give myself a break. And it's not an easy process. I mean, the way that Tanisha explained all of this, makes it sound, I think, very easy, but it's work like anything else. You practice, spend a little bit of time every day on it, and you too, will certainly get better at it. It's really, it's been a game changer, I think, for lots of us at Sneed, and it's certainly been key for me. I think, I'm certainly a lot less hard on myself as a result. I've got a couple of questions that I'm going to throw out to Tanisha, and like I said, if that inspires any thoughts or reflections from anyone in the group, please feel free to type it directly into the chat. So jumping right into it, Tanisha, ACT is something that might be new for lots of folks. I think the idea of seeing counselors or psychologists is certainly not new to folks, but I guess some questions about where it all fits together. If someone is seeing a therapist currently, let's say for depression, is it appropriate for them to attend, an ACT workshop or have, add ACT as another modality? Is it going to complement things? How is it going to fit if somebody's already seeing a therapist for, say, something like depression?
Yes, actually, ACT encourages, I think part of accepting our feelings and our thoughts is really then to notice if they're becoming problematic, to seek out help, and that becomes part of the committed action, and looking at our values of, in that case, self-care and mental health. So ACT can fit in nicely with other therapies. Of course, you'd want to talk to the individual counselor, psychologist, but it's really more a way of being and getting in the habit of really approaching life in a more mindful way.
Just on the subject of, say, depression, for example, can ACT be used as a substitute for an antidepressant medication? Would it help to that extent? Can it be used to help get to get oneself off of antidepressant medications?
I wouldn't recommend that. I think in terms of treating mental health conditions like anxiety or depression, often the research will say that a combination of medication and counseling will help. So ACT would be part of the counseling piece. So You might find that, once you're engaging in more self-care activities, once you're able to notice and accept your thoughts and feelings, that you perhaps could reduce the dose. But of course, those are decisions that you and your doctor have to make. So I think it would actually be a nice complement. Sometimes people do need medication just to kind of kickstart things. So you might not, if you're depressed, you might not even have the energy to attend an ACT workshop. So you might need medication first just to kind of get kick-started, and then start really taking care of your mental health and your self-care.
Yeah, ACT really does strike me as an overall wellness set of strategies, or maybe a wellness approach. And I think incorporating those ACT strategies, as you've talked about, the different exercises or activities into your daily routines, really has that potential. And the research supports that. It has the potential to increase overall wellness. And I think, the statement you just made about it complementing existing supports like, medications or whatever, really, I think it's more of a good all-around holistic approach. So that certainly makes sense to me.
Yeah, I would also like to add to that I wouldn't consider an ACT workshop a substitute for individual counseling. ACT might help you identify that you need individual counseling. For example, trauma comes to mind. So say you realizing that you're overcome with your reactivity due to a past trauma or PTSD. An ACT workshop isn't going to address that, but it might kind of tell you in terms of your committed action that you want to go get specific help for that and to seek individual counseling.
So it sounds like ACT is just like, might help create awareness, and it's a good complement to other counseling modalities. So it's not something that contradicts it at all. Rather, it's a good complement.
Yeah, it's just a way of life.
All right. Something that I've wondered myself, and I think I'm going to trust that others in the group have also wondered about, is, what is that difference between mindfulness versus meditation? You've spoken about kind of both of those a little bit tonight. You spend more time talking about mindfulness, but yeah, what is the difference between mindfulness and meditation as practices?
So mindfulness is really, again, that's approach to your situations or your activities in life, and it means paying attention in a particular way, on purpose, to the present moment, and usually with an attitude of non-judgment. Whereas meditation is more of a formal, and you can do that with anything. Like we talked about, you can be mindfully walking, or you can be mindfully washing the dishes or brushing your teeth or interacting with your loved ones. Whereas meditation is more of a formal practice where you focus on one thing. And so the one thing can be, there's many, many different types of meditations. So the one thing we do in mindfulness practice is we focus in on the breath. So that would be mindfulness of the breath, but that's a meditation. I talked about body scan. So that's the focus then is the sequentially the different sensations of the different body parts. You can focus in, meditation can be focusing in on a mantra. So some people have a certain phrase that they repeat over and over. You can meditate on a sunset. So does that help answer your question? So meditation just means to focus on one thing. And the technique for a meditation is the same in mindfulness. And then when the mind starts to wander, which it will, then you just remind it non-judgmentally, non-critically. There's no way to do this wrong. You just remind it to come back to the object of focus, whether that's the breath, a sunset, or a mantra. Does that help explain?
I think so, yes. And there's a couple things stand out for me. One is that there's no right or wrong way to do it. Like, I think that's an important piece, is that, I think people, expect that they're going to, they have to follow a formula, or they have to do it a specific way. But I think knowing that, and you reinforcing that idea that there's no right or wrong way, it's just that, it's a practice. You're not seeking perfection, you're seeking just the practice of doing it. I think that's something that's important, an important takeaway for everyone. And I think, the way that you describe that, then I see in my mind, the meditation is really about, focusing on something. So the meditation is like a specific focus, where mindfulness is more paying attention to whatever's happening. It's more of a just paying attention, and meditation is kind of a much more focused attention. Is that a good paraphrase?
Yeah, usually when people meditate, they'll sit in a certain posture, or you can meditate laying down, and you'll choose a particular time. So it could be 3 minutes, like we did today. That was a meditation. So that could be 3 minutes, or it could be 20 minutes. I wanted to get back to one point you made that I thought was critical, and there is no way to do this wrong. In fact, you really want to bring an attitude of non-judgment. So it's really, we invite you to really get out of those critical thoughts, because I often hear like, oh, I'm not doing it right. I can't keep my mind on the breath. I can't keep my mind on this. And you know what? That's perfectly normal. And the only thing you have to remind yourself is when you notice you're doing it, just come back to the breath. And some days are worse than others. Some days, it's really, really, really difficult to keep your focus, say if it's on the breath, or say if it's mindfully paying attention to your child, or mindfully washing the dishes. I had one parent in the group, and she tried the mindfully washing the dishes, and there were just too many distractions in her house, and she just couldn't do it. So she had to choose something else. And you know what? That's all good. That's all good. Yeah. Don't beat yourself up, because it's adding suffering to your pain.
Yeah, no, indeed. I recall we talked about as a team, when we were going through all of the ACT training, that even 10 minutes a day is really sufficient in order for you to see gains and with the practice. And one of the things that I tried to do personally was I was really bad about always having my phone in front of me, and I'd be like, just on my personal time, I'd be like, on Instagram or Facebook, and I'm not really focused on anything, just sort of scrolling aimlessly. And what I've tried to do is just spend 10 minutes where I put the phone down, and just, whether I'm sitting on the couch or outside or wherever it is that I am, and just sit and pay attention to my surroundings. And that's that mindfulness piece of I've got no intention. There's nothing specific that I'm focusing on, but I'm trying to pay attention to what's going on around me. Do I hear birds in the distance? Do I hear trucks going down the street? Do I hear any of the animals we have in the house hopping around? And I think that that's a piece, that just that 10 minutes of putting the phone down and just being present in the moment, that's been enough to really I think springboard or really enhance my ability to just be more mindful in a general sense. Certainly it's a practice that I think it's a lifetime thing, something you'll do forever. I'm certainly not perfect at it. My mind bounces around all over the place, but just constantly bringing it back, being non-judgmental, like you said. Doesn't matter if my mind wanders and I start thinking about something else. Just come back to, what are you doing right now? Where are you at? And just notice what you're experiencing. Notice the body's sensations. That's been super helpful for me, personally and professionally, I would say.
And I would suggest for our parents, because we know how busy they are and how stressed they are, even 3 minutes, 1 minute. When I started doing this, I would just, when I stopped the car at a stoplight, I would just use that pause in my life to be mindful. I would just notice what the light looked like. I'd look at the sky, look at the other cars. I have a nice view when I'm driving to work. I would just look at the view, the sunrise, whatever it was, just that brief moment to get back in the present moment.
That's good. Yeah, I like that.
I'd also like to say about your practice of just kind of sitting there and noticing what's going on, whether it's sounds or whatever. We call that choiceless awareness, and that's perfectly okay too, where you just let your mind go to what it's going to go to. So it might go to a sound, it might go to a body sensation, but really notice where the mind's going.
So again, what I like about that is, you know, you said it's not wrong. There's no right or wrong, right? It's about just being present in the moment, noticing what you're doing, paying attention to, you know, what you're doing in that moment. Yeah, that's good.
And that amount of awareness, then that's going to be what helps you, because it's when you get into those self-critical thoughts or those critical thoughts about other people, then you're going to be able to start to notice them, and that's going to just give you that little bit of space to separate yourself from the pain of that moment.
Now, you know, I think the mindfulness resonates for me a lot. Something that you know, I think that myself and lots of folks would probably have the same experience, but you know, not having a lot of luck with meditation, that more intense focus for that, you know, however long period of time. If somebody is struggling, or you know, they don't have a lot of luck with meditation, are there other options? Is there anything else that you would suggest as a strategy?
Yes, I get that a lot. So I think it's just what we're talking about, just mindfully paying attention to, you can just choose one activity. So I would suggest, like my colleague Judy Glass, her thing is she gets up in the morning and she mindfully drinks her latte. And she just really enjoys it. Just enjoy the taste, the smell, just enjoy the activity.
You know, I think for the coffee addicts in the group, you know, you could be practicing a mindfulness or doing that mindfulness exercise many times a day if you're a caffeine addict like I am. So
I
that's a
would
good
just
example.
also maybe add to that like a grounding exercise. You know, so you can do mindfulness of a simple daily activity like drinking a cup of tea or coffee or whatever it is you choose. The other thing is maybe just simply noticing. One activity you can do is called the three senses. So just notice 3 things you can see, 3 things you can hear, and 3 things you can feel. And often I suggest like try to really feel your feet against the ground. If you're sitting, really feel your body against the chair. Maybe feel like your clothing touching you. And that will just help ground you in the present moment. It's very simple. It's very brief. For those that really don't like the word meditation.
Yeah, yeah. And you know, I will admit that, you know, before being introduced to ACT, mindfulness and meditation, yeah, I thought it was kind of hokey. You know, I thought it was this sort of hokey, I don't know, thing, sort of pseudoscience. I mean, you clearly you laid out the evidence before, and we covered the evidence in our training that we did at SNEV. It is an evidence-based strategy. It is, the data is there, it supports it, the stuff works. It is not hokey, but I think that initial, you know, my initial reaction was, oh yeah, this, you know, meditation, mindfulness, this is, you know, this isn't real, this isn't science. But yeah, I mean, I've clearly learned that I was wrong. And, you know, this is not something that, you know, at first might sound like, oh, it's not for me because of whatever, you know, thoughts or emotional baggage that we have. But at the end of the day, it's really helpful. It's a really nice set of practical strategies, you know, as you've shared. One of the things, going back to, you know, you showed that diagram that, you know, yes, you know, you said it's sort of a complicated term, that hexaflex and the various different elements, that acceptance piece that you talked about at the beginning. Does acceptance mean that you have to be satisfied with things as they are and sort of resign yourself to just kind of tolerate things? Things are what they are, and you just need to learn to deal with it. I'm wondering if you can speak a little bit more about what acceptance really means, because I know that that's a concept that lots of folks really struggle with. So yeah, maybe we can speak a little bit more about that.
Yeah, acceptance really means just having a clear picture of reality. And I think actually acceptance is the first step to actually change things. So the example I gave about, you know, ACT might, you know, if you start to accept your thoughts and your feelings and you realize that they're really a barrier for you in moving forward towards your values and what's important to you, then you might go for counseling. But the first part to going to get help to change is to accept, right? To accept that rather than repress and try to get away from these things. You just accept that you are having this difficulty. I think a lot about, the changes in society, right? Some of the racial prejudices and the Black Lives Matters movement. That all starts with acceptance that there's a problem that exists. If we're not accepting that there is racial prejudice in society and people are treated unfairly, if we just think, oh, well, everybody's treated the same, then we're not going to be able to address the problem. So I think the first thing in changing things is to accept reality the way it is, and then acting appropriately towards your values. Does that make sense? It's the same in the example I gave where the mother, yes, we have to accept that our children have challenges. They have special needs. They're different than the typically developing child. We accept that, but that doesn't mean that we just stay satisfied with the status quo. We do our best to make the most of their potential, whatever it is. So the example I gave where the mother was avoiding doing homework and therapy with her child, the first piece was having the awareness that she was engaging in this avoidance strategy because she wasn't accepting her feelings of frustration. She was trying to get rid of them, right? By engaging in homework and therapy with her child and accepting that it might be a frustrating experience at times, but hey, I'm going to do my best to learn strategies to calm myself and to engage my child and help my child focus their attention. Does that answer your question?
Yeah, no, that does. That's good. And I think that the right at the very beginning, a statement you made was around trying to get rid of the problems can make them worse, right? And that's part of, I think, or that's the maybe the foundation of that acceptance idea. If actively trying to suppress, repress, or just get rid of a problem is going to make it worse, then it naturally does seem that idea of just accepting it, that this is the situation. These are my thoughts, these are my feelings, this is the situation I find myself in, accepting it for what it is, non-judgmentally. And then at that point, I think then you're ready and able to take steps to do things differently. Right? You're at a place where now you're ready for changing your behavior, setting up goals, understanding your values, what you need to work toward. But it's really absolutely, as you said, it's accepting the situation that you find yourself in, accepting your thoughts, accepting your feelings. That's pretty critical for sure.
Yeah. So what I'm trying to say is you can't change over in this side of the Hexaflex. You can't change what you don't acknowledge or what you don't accept. So you have to accept first, and then you can engage in the change processes towards what it is you value or what's important to you.
All right. Well, there's been no other questions that have popped up in the chat, so I'm going to go with, you've answered people's questions as you were going along. So I would say thank you very much again, Tanisha, for sharing all this information with us tonight. Again, great information, great strategies, very practical things that people can, go away and start doing tomorrow for their own wellness. I want to thank all of our participants for spending your nights with us. Very much appreciated. The Resource Center at the Sneed Family Foundation is there. It's a service for the community. Kate is one of our ambassadors who works for the Resource Center. Tanisha has mentioned Judy. Judy's one of the other Resource Center ambassadors. And then their third colleague, Lorraine. They're there as ambassadors and navigators to help connect folks to resources and services in the community. So if you have any questions about any services, resources, whatever, if you're interested in being navigated or shown, given access to different resources, connect with them and they will help connect you to the resources that you're seeking. So please do contact us. info@senevfoundation.org is up there as a general email address. Please visit our website, senevfoundation.org, for just more information about our programs and services. We do offer workshops just like this one, presentations monthly. It is the second Thursday of every month at the same time, 6:30. So you can book that in your calendars right now if you like. On the website, it not only talks about the resource center and the navigation opportunities and workshops, but there's also links to all the other programs and services that we do offer. Thanks again for spending your night with us. Please do keep us in mind for other future workshop opportunities. If you're looking to find out what's going on in the community, whether it's some training for yourself or others, sign up for our newsletter, stay in touch, and we hope to see you again at future workshops.